Good morning, everyone. Today's topic is we'll be just talking about how we come to the diagnosis of dental caries, and we'll brief you about how exactly you can counsel the patient if he or she is having any dental issues. So coming on to the dental caries, like we have spoken into last few classes, dental caries is one of the most common diseases, and dental caries is multifactorial in the etiology with bacteria susceptible tooth surfaces, and diet it plays a very important role in it. So definitions, yes, it is an infectious microbiologic diseases of the teeth that results in localized dissolution and destruction of the calcified tissues. And of course the plaque which adheres to the tooth surface, this is gelatinous mass of bacteria adhering to the tooth surface which you have to constantly remove. So you can use different procedure like flossing, brushing the teeth, once in the morning, once before sleeping, so that this plaque does not stay, right? So according to the WHO, it's a localized post-eruption pathologic process of the external origin involving softening of the hard tissue and proceeding to the formation of the cavity. So 1, 2 is tooth surface without caries. 3, you can see there is initial caries. 4, 5, 6, they are all with caries. Okay. So the first sign of demineralization, as you can see, the third tooth, the number 3 tooth, where it has been marked number 3, that is the first. The 2, you can see there is a slight white spot. That is the first sign of demineralization. And when you go ahead, this demineralization, like for example 3, it increases with time. And the fourth tooth, it dissipates a dental caries, which is, of course, you can see it's the color of the tooth. So this is the white spot, and the third is the enamel surface is broken down. We have got a lesion. Okay. In fourth number, a filling has been made, but the demineralization has not stopped. That means adjacent to the wherever the filling has been done, there is still more decolorization. That means caries is progressing. That is secondary caries. The demineralization proceeds and undermines the tooth. The tooth has been fractured. In the 6th figure, you can see the tooth has been completely fractured. It's totally demineralized and the tooth is gone. So theories, we had spoken in the first class about the theories. If you remember, I won't go much into the theory part. What are the theories? So we will straight away jump on to the current concepts of the etiology. So how much time this plaque stays, that is a susceptible host, the cariogenic oral flora, all these things, how much time the food is sticking onto your teeth, all these factors make a person carious. So as it is, you guys know that once the tooth pain starts, it's very difficult. So it's your diet, how much plaque, how much time, and which surface, which part of the tooth. All these combinations, if you take, this makes the etiology of the dental caries. So primary factors are, of course, your tooth, plaque, diet, time, and the modifying factors is if you have less saliva, if females, they tend to eat more chocolate, so they're more caries prone, and hereditary, race, occupation, all these things, they matter. Fine. So what about the tooth surfaces, how the tooth is, okay, what are the characteristics? And what is this plaque? So plaque is something which is a soft, translucent, tenaciously adherent mass accumulating onto the tooth surface. It is composed of an aggregate of bacteria, salivary glycoproteins, and inorganic salts. It is called as a microbial biofilm. So that is plaque. So plaque plus sugar, it's a cariogenic plaque that has high concentration of Streptococcus mutans and Lactobacillus acidophilus. Of course, a diet which is rich in refined carbohydrates and low in protein, it favors dental caries. Frequent snackings between the meal, what we eat, again it causes a lot of dental caries. So protective factors which include is phosphates, calcium lactate, fluorides, vitamin D, vitamin B, all these factors are important in diet. Time is another significant factor in the development of dental caries. During long intervals of undisturbed plaque stagnation, the plaque pH is lowered, favoring the production of the organic acids that demineralize the tooth structure. So what are the modifying factors? Modifying factors are saliva. Saliva is a major modifying factor. It has a very protective role in preventing the caries. It does a flushing action, buffering capacity. It has got antimicrobial effect. It has got remineralization property. What about systemic health? Any kind of neurological disorder, mental retardation, patient cannot take care of his or her teeth. Then there is Sjogren syndrome, okay, where there is a greater risk of caries. Antihistaminic, if patient is taking antidepressant, all these things, causes dryness in the mouth and it causes caries. Females, like I said, they are more susceptible to the caries. The hereditary part, of course, there are studies which have been demonstrated that parents having a lot of carious tooth, when the child is born with a lot of carious tooth, fine. So race also, what kind of race, what kind of geographic environment. So environment which has got a high phosphate content in food and water, and there is less fluoride in the water, causes caries. So if the fluoride is more, the caries activity is diminished, but if it is less, then caries tends to happen. So if there is high phosphate content and there is high fluoride in the water, caries activity is not seen. Occupation, what kind of occupation? Whether the patient works in bakery, he's taking sweets all the time, night shift workers, truck drivers, all these people, they tend to develop more of the caries. So what is a diagnosis? How do you come to the diagnosis? So as it is, you guys must be knowing diagnosis is through, and it's actually, it's divided into dia, through, and gnosis means knowledge. That's how you get this word diagnosis. Okay, so once you're through the knowledge, you know what is it. So what are the methods? So you can have a lot of methods. It can be visually checked. You can have a visual examination. Then we have different kind of dyes. Now we have recently a endoscopy filtered fluorescence method also, which has come. These are all the advanced methods. So coming on to the conventional method, take an X-ray. We have these small IOP X-rays. We have digital imaging, and recent advances you can go for MR imaging. So that is magnetic resonance microimaging. All these factors. So what are the need for advancement of various methods? So caries is something where if you detect it late, then the whole tooth is destructed. So as early as possible, if the caries is detected, we can prevent there and then only, and we can save the tooth. Tooth is such a part in the body which cannot come back again. So if it is lost, it is lost. There is no replacement to it. That's why it becomes very important. So we have different lasers also for detecting caries, argon laser, diode laser. I'm just giving you what exactly has come into the diagnosis. So it's just basically very knowledgeable for you guys. So newer technology is infrared technology which has come, multi-photon imaging, optical coherence topography. The US Public Health Service has given the foreign criteria determining the presence of caries. So anything which is softening, which is opaque and softened enamel, it's and if a radiographic evidence of dental caries is taken, then this is something which is caries. So you must have seen, if you have visited a dental clinic, we have this mouth mirror probe, and we check with the probe. We just pass it on the surface of the tooth, and if any catch is there, that means the caries is detected. So cavitation, surface roughness, anything, all these things causes caries. Then you have the visual examination. We have these mouth mirrors where you can check, caries is there. It can be, the tooth is easily visible, and if you see any dark spots, you can easily make out that the patient has got caries. Fine. Then you have the dyes. We have the endoscopy filtered fluorescence method. You have the ultraviolet illumination. UV light increases the optical contrast between the carious tooth and the healthy tooth. So caries is easily detectable through UV light. Right? Then you have the ultrasonic imaging, which detects caries, lesions of the smooth surfaces. You have fiber optic transsimulation. So this is something where decalcified areas, lower index of light transmission generates a shadow corresponding to decay. Then you have the wavelength dependent FOTI, then digital imaging fiber optic transsimulation devices. You have that to detect the caries. So all these methods are used to detect your caries. These are the procedures. If you can make out, these are the pictures, just giving you a brief about what are things which have come. So things are modernized now. It is not the same old procedures. So the basic tools are of course the mouth mirror and the probe to check the caries, but now things have changed. We can get an image review immediately. So then we have the dye penetration method also, which you can use it for the caries, but the dye should be safe enough for the caries. So we have these Procyon dyes, calcinin, all these Ziglo dyes, Brilliant View, all these dyes, they are used for the caries detection. And it's a basic simple principle, 0.5% of the basic fusion in propylene glycol. So several dyes have been tested. Then you have the endoscopic filtered fluorescence method, which is by Pitt Logomeron. He gave that method. The tooth is illuminated with blue light 400 to 500 nanometer, and when fluorescence tooth is viewed through a specific broadband gelatin filter, white spot lesions appear darker than the enamel. Then you have the radiographic assessment. Best is take the radiograph, you can check for the caries. So we have these x-rays where we take the x-rays inside the mouth and we can detect where the caries is there. Then you have another technique of the x-ray, that is zero radiographic technique. So recent advances, we have the digital radiographic method technique where we take digitally, and then you have the charged coupled device. So they are the one which are put inside the mouth, as you can see the figure, and the image is detected. It's processed onto the screen. So you can easily check for the caries. Then you have these different radiographic methods only, which of course again I wouldn't like to go into detail because we are just giving you idea about it. So you have different type of lasers. You have argon, diode lasers. All these lasers, they are used to check for the caries. So this is something topic which I just wanted to tell you that what are the difference. We just want to brief you about what are the difference. But before I end the topic, probably I would just like to talk about how would you go about giving instruction to the patient. So one patient comes and if you feel that patient is, you can see slight these chalky spots like we were talking about. Please tell patient to use fluoride mouthwash before sleeping. Once he is done with the meals, he has water, everything, he just swishes mouth with the fluoride mouthwash and he will spit it out, and this fluoride, let it be there whole night. That is one thing which will prevent caries. If patient is very poor, he cannot like in the rural areas, at least what patient can do is put salt inside the water and gargle his mouth before sleeping. So these are small methods which prevent caries. Of course, educate patient not to rub brush very hard. If you is rubbing the brush very hard, it's going to wear off the tooth, it's going to wear off the enamel. So it's very important that patient does not brushes very hard. And having said that, I would like to put in, there is a simple basic technique of brushing also. So where brush, it just has to remove the food particles. It doesn't have to be rubbed. It's not going to cause any kind of shine inside the mouth. So it's very important that patient does not brush too vigorously, and patient just helps in removing the food particles. So what he can do, he can brush in to and fro motion inside the mouth, so that he just removes all the food particles. And we have techniques like floss also. So flossing is very common these days. You can open any video. It's not only for the patient, but it's for you as an individual also. So flossing is something which is very easy to use. Please start using flossing because it clears in between the teeth. The food does get lodged, and if it stays for the whole night, then flossing is an issue. So please ensure that you guys yourself start using floss. you educate the patient about the floss. So these are the basic facts, you keep in mind about, the main thing is avoid snacks. And if you avoid snacks, probably, the caries is something which will be less sticky to the tooth. And try these. Of course, you cannot brush during the day because everyone is busy working, but of course, be ensure that you always brush your teeth before sleeping. The toothpaste has got fluoride content, so if you use toothpaste both the time, of course, your tooth will be fluoridated. So caries is less. With this, probably I would end the topic. I just want to give you a brief idea about the diagnosis, how to educate the patient, what all tips you can give to the patient. So that is something I just wanted to talk about. So with this we come to the end of these dental caries as a topic and about educating the patient regarding it. Thank you very much. Have a good day. Bye bye. लिंक भेज देना प्लीज.